Okay, so what I have is, I brought me some sterile gloves. Oh, size is not right here again.
7.5.
I'm blind. I'm blind. I'm blind. It's right there.
It's on the back.
Yeah. So, well, it's up here too, but it's like hidden in the corner there. Okay, so I have my gloves, sterile gloves. I have my tea sponge, okay, which is the tea sponge that goes in between the trach, okay. It's already pre-cut for you. And then I have some gauze sponges to clean with, as well as some cotton tip applicators, okay. I have my trach collar. There, you'll see different ones. You'll see some that are, this one and that one's, I was trying to see if there's one. These are all Velcro. You'll have some that have ties on them. These are the nice ones. The ties are kind of a pain. So but for checkoff, she'll be using the ties. These little soft collar ties with ties. Okay? Alright. So, what part of this procedure is sterile, do you think? The cannula. Is any of the rest of it sterile? Any of the rest of it sterile? It's not. So once you do cannula, so we suction, that was sterile. We're going to replace the cannula, which is sterile, and then we're going to clean, which is not sterile, okay? But you can keep your sterile gloves on to clean with, okay? You don't have to change your gloves out. Okay, so the first thing I'm going to do, a lot of these cannulas are not replaceable. You have to clean the actual cannulas, but for the purposes of this, we're going to replace it, okay? So I'm putting on clean gloves first, because I want to come over here, take the oxygen off. I want to put my hands on the faceplate. Why do I have to put my hands on the faceplate?
So you don't pull it all out?
So I don't pull the whole thing out. That would be bad, right? Okay, so I'm going to put my fingers on the faceplate, stabilize the faceplate, take this out, just set it over here. I'm also going to go ahead and remove this dressing that's under here, okay? And then I'm going to put their oxygen back on them, okay? Everybody good with that? And then I'll remove these, because now I need to put on my sterile gloves so that I can replace my cannula, right? Okay. Now, what part of this do I need to do first before I put on my gloves, my sterile gloves? Open up this, because if I put on my gloves, can I open that now? I have to get a new set of gloves, right? Okay. These are kind of tricky. You gotta be kind of slow with them. The packaging for these. Okay, just got to be gentle with them. So I'm going to move this over closer to me. And I'm going to move, I don't need that anymore. I'm going to put my gloves on, okay? Give yourself plenty of space to put your gloves on. This space is bigger than what you're going to have. If you have stuff on your table and you do this, what happens? It's no longer sterile, right? Because it's going over your sterile field, right? So if you have to go to the edge of your table and do your gloves, do that so that you're not overlapping any of your stuff onto your sterile fields, okay? All right, I'm gonna open these up. All right, sterile is getting, right? Can I move this? No, just leave it, okay? How about doing this? Just leave it, just leave it. You're gonna contaminate yourself, just leave your stuff there. All right, so the only thing that's sterile is this, okay? I'm gonna have a clean hand and a sterile hand again, okay? Dominant hand is going to grab this. Okay, I'm gonna come over here with my clean hand. I'm gonna remove the oxygen. I'm going to stabilize the plate with my clean hand and put in the new cannula, which will click in so that it's in there good. Okay, so it stays in there. That's it. I don't have to be sterile anymore. You can change your gloves at this point if you want. I can fix this now. It's driving me crazy. Alright, so the rest of the procedure is clean procedure. Give him back his oxygen. Okay? So, opening up these, you don't have to be all delicate and terrified to open these. You can just open them. If they come off paper a little bit, it's okay. Because what we've done sterile is already finished, okay? I'm opening up my gauze. I'm going to have a wet gauze and a dry gauze. Tea sponge. These. I'm gonna lay these on the one I'm gonna do this to be wet. Okay. All right. So I'm just gonna pour a little bit of sterile saline on this one because I want one that's wet. Okay. I'm gonna come over here, take my patient's oxygen off. I already took off their old sponge when we took out the cannula, remember? Okay. So trachs get really nasty. Anybody ever seen trachs that need to be changed and cleaned? Really nasty, right? And it gets stuff caked on it, and you may have to really take, I mean, your trache's gonna be clean tomorrow, but you may have to actually sit here and kind of move this around to get all the gunk off the trach, off the base plate and stuff, okay, which is what you can use this for around it. Then use this one. You may need to get this, and I would wring this out. Why do we have to wring this out? Huh? You can get water inside the trach. Because even underneath that trach, this is what it looks like right here. See this one? That's what it looks like underneath there. So water, if you have too much water in your sponge, and you're going around underneath this trach plate cleaning this, and it's soft and wet, it's at risk if they take a breath for getting inside their trachea. Okay? So I'm going to clean around it, kind of under and around the sides of it. Now, it's all wet, because this is wet. Why do I have to dry it off after this? Skin breakdown, maceration of the skin, right, if it stays wet. Because it's already a moist area, so we want to make sure it's dry when we're done cleaning it, okay? So I'm going to go around, I'm going to dry, kind of get behind it a little bit, do that, okay? So all done with that. Now, tea sponge. If my facility doesn't have any tea sponges in stock, can I just go get some gauze and cut them? Why not?
Around the opening of the trach.
And where can it go? Where can those little fibers go? In the trach, in the lungs. And then if you have debris in your lungs, what does that lead to? Pneumonia, bacteria buildup, trouble breathing. Okay, so you can never cut a tea sponge on your own. Okay, because it leaves little fibers that can get into the trach. Okay, so I'm gonna take this, and the mannequin's kind of a tough one. I'm gonna tuck one side in, up under here, and then I'm gonna tuck the other side, up in there. Push it under that plate a little bit. And there we go. So there's his new tea sponge, okay? Now I'm gonna change trach collar, okay? If it's dirty and we wanted to change, if it was dirty, we would change it. If not, we would just leave it. Okay, but if it's soiled, we want to change it. So to change a trach collar, you always want to tie in to one side with your little ribbons here. Maybe turn around Velcro. Secure this side, and then tie in. This is if you're by yourself, okay? Which you're going to be by yourself. Your patient could probably sit up too if they're unconscious. And I'm going to tie in this other side. Okay. Why do I do it like this?
Because if you took the other one out before, then it would just kind of fall out.
Yeah. So I put this one in place and then take off the other one. Because I want it to remain stable and in place, okay? Okay, because if I take this one off and turn around to get my other collar and that patient coughs, the trach's coming out, right? Okay, if you have another nurse with you, You can have the other, you can take it off and have the other nurse hold the faceplate down while you tie in the new one. Or you can tie in one side, thread it through, and have the other nurse tie the other side after you've taken the other one off. Because you've got somebody there to help you stabilize the trach while you're doing that. Good? And that's it. Suction, change the cannula, clean the trach. Good? Okay, questions? Nothing? Not yet? Okay. Alright, you got your picture of your supplies that you'll need to get, the one on the bottom. Okay. What you'll need when you come in.